So next is functions. So functions, arterial supply we are going to study, and the clinical correlation, which is the cerebellar ataxia or cerebellar syndrome. You will learn the functions much more in physiology because it is a UQ question there. So they will also you will learn there. Anyways, you will learn the functions. I will just tell you three of them. Comparator function, that is we are doing some movement which the cerebellar, that is the higher center, has sent us to do. It has given the efferent information, but whether it is correct or not, whether the movement is going right or not, whether it is executed properly or not, that function, that comparison is done by cerebellum. Okay, so that comparator function is there, helps in learning new motor skills. Of course, there is paleocerebellum and neocerebellum, which is also involved in planning motor activities. Unlike cerebellar cortex, we have motor cortex or the motor functional area, but it also helps in learning new motor skills and all. Damping and braking action, which I am going to teach you, is that once if a doctor is asked to hold the hand of the patient, and the patient is asked to do a certain movement, and after some time, if the doctor leaves, the patient is supposed to flex the arm, and then after he has started doing flexion, the doctor leaves the hand, but you should keep the hand on his mouth so that it doesn't hit him. Okay, this is actually part of clinical part, but it still comes. So after some time, we have this subconscious subconsciously we stop our hand from hitting our face. That function, that subconscious function, which that subconscious movement that we do is called rebound. It is called that rebound phenomenon. If the person is unable to do, it is called rebound phenomenon. If the person is able to do, that means his cerebellum is normal. That beautiful subconscious, we stop our hands, that is by cerebellum. Okay, that is a function of cerebellum, that is damping and braking action of cerebellum. Now comes the arterial supply. Arterial supply, you can learn like superior cerebellar artery and posterior and anterior inferior cerebellar artery. Superior cerebellar artery, anterior and posterior inferior cerebellar artery. And then after writing this arterial supply, you can write clinical cerebellar ataxia or syndrome. So what happens in cerebellar ataxia? Lesion in cerebellum occurs. Okay, and what are the parts? Archicerebellum, paleocerebellum, neocerebellum. These are the three morphological divisions. So they three have different functions. Archicerebellum is related with posture, paleocerebellum is related with function and motor activities. Neocerebellum is also same, but it is more of planning, and this is more of executing. Okay, so archicerebellum, it is related to posture. Okay, so posture will be imbalance, will be there. Truncal ataxia, staggering gait, which is a specific type of gait which we see. The person would be staggering while walking, something like that. And nystagmus, that rapid eye movements would be very jerky. So jerky rapid eye movements, they will be really jerky. Okay, that is nystagmus, that we could be see. Then comes paleocerebellum. Paleocerebellum is executing the movements. Okay, so we have tendon reflexes, which is execution of the movements. So those deep tendon reflexes will be absent. So when we are doing the knee jerk, we will see pendular knee jerk. Okay, and hypotonia and muscles will be, wastage of muscles will be there. Okay, next comes neocerebellum. Neocerebellum is planning and controlling the movements. So in case of dysmetria, there will be the inability to measure the distance. If we keep our one finger like this, and we'll ask the cerebellar, the patient suffering from cerebellar syndrome, to touch this hand continuously, and after closing the eyes, he might not touch it, he might past point it. Okay, that is called past pointing technique, that is dysmetria, and the test we use is finger to finger test or finger to nose test. Then comes intentional tremors, that is while the person, the function of the cerebellum is to do action. So while the person is doing the action, he will have certain tremors. Okay, that is intentional tremors, which is different from basal ganglia. And the muscles will be hypotonia, so muscle wasting will be there. Adiadokinese, that is alternate rapid movements where we are doing pronation and supination. If we ask the person to do this, he won't be able to do it properly, rather he will do like this. he will do like this, he won't be able to do it properly. Okay, then rebound phenomena, which I told you, that the person has that subconscious thing in subconsciously we stop our hand when the doctor removes his hand while we are flexing. So that is called that is the function of cerebellum, but it is lost during cerebellar ataxia. Hence that phenomenon is called rebound phenomenon, which is seen in patients. So this is seen in patients. And how it is different from basal ganglia. In basal ganglia we see resting tremors, and we see, I am not writing spasticity, I am not sure of this, but I think in cerebral ataxia we see spasticity, which is in lesion. I'm not sure, so I'm not teaching you the wrong thing. Basal ganglia we see resting tremors and hypertonia is there. Okay, increased tone of muscle is there. That's it. Thank you. So we have finished cerebellum, and if essay as cerebellum comes, you need to write all of this, like you have to write detail about the deep cerebellar nuclei. I have just drawn the picture and made you understand. You need to write one more page for internal structure, and 1, 2, 3, 4, 5 pages for cerebellum as an essay. Thank you.